Well, good morning, everybody. Thank you very much for joining us today for our Member Roundtable webinar. We appreciate the time that you've taken to learn more about our plan changes for 2018 and to join us for a little time this morning. My name is Lee Curtis, and I am an Outreach and Education Consultant here at Community Health Options, and I'm joined by my colleague Beth O'Hara-McClavick, also in Outreach and Education here at Community Health Options, and we're very pleased to be able to present you some information today around plan and benefit changes. We will have a chat feature on the webinar, so we encourage you to pose questions within the chat, and we will probably table those to the end and be able to answer those at the conclusion of the webinar. So please feel free to chat within that chat feature as questions come up. As I mentioned, we do encourage you to ask questions, and we do have an hour for this, but we will reserve some time towards the end. You're going to learn quite a bit today around things that apply when choosing your health plan for 2018. We are in the midst of open enrollment, as you probably know. Open enrollment closes soon on December 15th, so it's very timely that you're able to join us today. So on the screen that you're seeing, this just gives you a quick agenda scan of what we'll be covering. We'll talk about the re-enrollment process, how you can compare coverage options, some tools and resources available to you, and then, as I said, our benefit and plan changes for the upcoming year. So just a quick overview of the purpose of our organization and our commitment to you. Our purpose is to deliver meaningful health insurance benefits that are designed to improve your health and well-being. And how do we do that? Well, we're proud of our extensive network. Our network encompasses every hospital in the state of Maine, as well as many New Hampshire and Eastern Massachusetts providers. These Eastern Massachusetts providers are select centers of excellence, including Dana-Farber Cancer Institute, Brigham and Women's Hospital, Mass General Hospital, Spalding Rehabilitation Center, and Children's Hospital. Our office is located here in Lewiston, so the service that you receive is local. And we have a very strong member service commitment. We are staffed with, as we said, local, knowledgeable, accessible and respectful folks. And finally, we're proud of our sufficiency of reserves. We now have solid financial footing, and we're continuing to focus on quality coverage and excellence in service in the years ahead. We'll talk a little bit more about some of these programs as we go through the process of today's webinar, but our focus is to really give you the most of your premium dollars, and we are looking at ways to offer innovative programs to you, our members. So these include our robust care management program, our chronic illness support program, and our RX Savings Solutions program. So as a brief overview, let's dive into the 2018 plan and benefit changes that you'll be seeing for the upcoming year of 2018. So some general changes that you'll see for all plans across all of our different plans that are offered for next year. The generic drug classification has changed. So for the upcoming year, currently some 2017 Tier 1 prescriptions for 2018 are going to move to Tier 2 or 3 based on cost. So as a result, some drug Tier 2 and 3 have been renamed for clarification. So going forward in 2018, Tier 1 will now be preferred generics, Tier 2 are generics, and Tier 3 are non-preferred generics and preferred brand drugs. In addition, for plans that include our chronic illness support program, you'll see the CISP designation, that stands for Chronic Illness Support Program. The benefit will be Tier 1 CISP drugs are going to be $0 out of pocket for you when filled through our home delivery program. So that's very important. Those CISP drugs need to be filled through home delivery. And Tier 1 will be $0 out of pocket. And Tier 2 and Tier 3 CISP drugs The deductible is waived, and your cost share, which would include your copayment or your coinsurance, is to be reduced by half when you fill through, again, that home delivery program. A change across all plans for specialty drugs is starting in January. Accredo is the exclusive specialty pharmacy with community health options. So if you have specialty drugs, those will be need to be filled through Accredo, and that's effective in January. And also more Tier 5 specialty drugs will be classified as mandatory specialty drugs, and those will also be required to be filled through Accredo. The CIS benefit is available only on certain plans, and we are going to talk more about that. Finally, a general change across plans for physical therapy, occupational therapy, and speech therapy. The limits for these have changed from a 60-visit combined limit to 20 outpatient visits for speech therapy and 20 combined outpatient visits for physical therapy and occupational therapy. So that's a change going forward for 2018. Okay, a little bit about the benefit changes for the Chronic Illness Support Program for 2018. As you'll see on this slide, the Chronic Illness Support Program benefit has been removed on our on-exchange Silver and Gold plans. So this was necessary to ensure plan performance, also while continuing to offer important benefits to support our members' health. Community value and community HMO cost share reductions also have more generous plan designs to offset the loss of that CIS for our cost share reduction eligible membership. And we'll look more at this in detail on a grid in upcoming slides, but wanted to let you know that those two options do have more generous plan designs to offset the loss of CIS. Also, the new CIS Bronze plan, which is community-based best HMO, and that's available both on and off exchange, and the Silver off exchange CIS plans, which are community partner and community HMO, are available as alternatives for members who are not eligible for cost share reductions and who benefit from CIS. So that is a change going forward. Some other notable changes around individual plans for 2018. When effectuating coverage, when your coverage starts, if the subscriber has a prior balance with us from coverage after July, this prior balance will be due as part of the binding premium payment. And if the full amount due, which includes the prior balance, is not paid prior to the effective date of coverage, the enrollment is going to be rejected. So that's important that you know that the prior balance, if one is owed after July of last year, must be paid as part of the binding premium payment, or the coverage will be rejected. And that's a change going forward as well. Another change is we have added language that's consistent with our collections policy. We've added language and just to the disclaimer within the member benefit agreement stating that we reserve the right to collect outstanding premiums for periods in which coverage was in force. So that you'll see that in your MBA, that disclaimer that we have the collections option. So specifically around the plan changes for 2018, 2 of our plans from 2017 have been discontinued. Those are the Community Value PPO and the Community Complete PPO. Those have been discontinued and they're being reintroduced as HMO plans for 2018. So what this means is for members with plans in 2017 that were Community Value PPO and Community Complete PPO, they will be crosswalked or re-enrolled into the approved replacement plans, and those are Community Choice PPO and Community Advanced PPO respectively. So that's for folks who passively re-enroll, and we'll talk a little bit more about that. But those approved replacement plans are Community Choice PPO and Community Advanced PPO. It's important to note that these 2017 plans did include the chronic illness support program benefit, and those plans approved as replacements, the Community Choice and Community Advance, do not include CIF. So we'll discuss in a later slide what factors will apply when you're making your decision as to whether to passively re-enroll or to choose a different plan that may be a little bit more appropriate for your needs. So this is an overview around what the re-enrollment, or what's also known as the plan renewal process, looks like. Basically, all that really means is the transition of current members from one plan year to the next. If a member does not actively re-enroll during open enrollment, they will be crosswalked or renewed into the same or similar plan. As I mentioned, that's known as passive re-enrollment. If you do nothing, you will be passively re-enrolled and you'll be crosswalked into the same plan you're in now or a very similar plan for next year. I'd also like to emphasize once again that open enrollment has started. It started November 1st and it ends on December 15th. So we have just a few days left before that closes. So that's an important change also from last year. It's a shortened period. There are two exceptions for, as we've mentioned, for plans that will enroll into the same plan, and those are the ones that have been discontinued. We mentioned Community Complete PPO and Community Value PPO have been discontinued. So if you passively re-enroll, you'll be crosswalked into either Community Choice or Community Advance, respectively. The other exception is our catastrophic plan, Community Safe Harbor. For members who passively re-enroll from that plan, you will be crosswalked into the same plan unless you're aging off or you're otherwise no longer eligible for that plan, that catastrophic plan. That would be if you're turning 30 years or older, or you would be crosswalked into the Community Reliant HSA plan. That's because you would no longer be eligible for a catastrophic plan. And in which case, if you did not want that to be the case, you'd have to obtain a hardship waiver from the marketplace. So by now, you should have all received your renewal notice from Community Health Options. That included your current year advanced premium tax credit and an estimate of your 2018 cost of the plan. It should also have included detailed information about some of the differences of the plan that you were in for 2017 and your 2018 plan options. Of note, some members will receive a plan comparison grid to show you what your product options are for those plans that no longer include a CIF benefit. So Value, Complete, Choice, and Advance. We recognize that where those plans will no longer offer CIF, we wanted to send out an additional tool for you to be able to compare what some of your options are. If you haven't already done so, we encourage you to use our website and select the Get a Quote option. There's a tool right on our website, healthoptions.org, and that'll give you a realistic estimate of what your 2018 plan choices and advanced premium tax credits will be. So if you haven't done that, we highly encourage you to visit our website and choose Get a Quote tool so you can see what your options are for next year. This is one of my favorite slides. How's everybody feeling? It's a lot of information, we realize, and it is crunch time in terms of open enrollment. So I know it can be a little overwhelming, but hopefully we will share some light on some of the questions you may have and options you may have for 2018. So when you're comparing your options for next year, we are offering 10 plans, both an HMO product and PPO product, that are available both on and off exchange, and we're offering 4 new HMO plans that are available off the exchange only. So you may be wondering what the differences are between HMOs and PPO for benefits offered. So one big difference is out-of-network benefits. HMO plans offer no out-of-network benefits, and that does not include emergency services rendered inside the U.S. but it's important to recognize that HMO plans do not offer out-of-network benefits, and that's a big switch from the PPO plans, and so we really want to highlight that. For HMOs, primary care provider or PCP selection is a requirement at the time of enrollment. So you must select a PCP to coordinate your care, and we encourage you to utilize that PCP to coordinate your care going forward. Finally, for pediatric dental benefits, the HMO plans that include pediatric dental will utilize our existing Delta Dental PPO benefit arrangement. So there'll be no out-of-network benefits technically for pediatric dental. We referenced on-exchange versus off-exchange. On-exchange means that you receive your advanced premium tax credit, or APTC, to help you pay your monthly premium, and that's income-based. You can shop at our website, healthoptions.org, and you'll be able to see what your options are for health plans for 2018 through us. But you will be redirected for your final eligibility determination and your final plan selection at healthcare.gov, and that's because healthcare.gov is the place that you'll need to actually enroll if you're getting an on-exchange plan that has advanced premium tax credit. Off-exchange means that you do not receive APTC to help you pay your premium, and you can directly enroll through us at healthoptions.org. So the bottom line is you can start at healthoptions.org no matter what, and if you are receiving advanced premium tax credits, you'll be redirected to healthcare.gov in the end. So we lovingly refer to this next slide as an eye test because it has so much information and the font is so small. But this is our plan grid for 2018. This shows our individual plans both on and off exchange, and this is in network. Across the top, you'll see the metal levels, bronze, silver, and gold. The next row will show the names of our plans. And running down the left-hand side shows some common services that you might use for your health plan, and in the middle of it, the meat of it shows what those out-of-pocket costs might look like, what category they might fall to. This information, this chart, is available on our website, so you certainly don't need to memorize this now, but it is available on our website. But we wanted to show you what it generally looks like if you're looking at bronze plans. There's a category for those, and silver plans, and then you can get a sense of, you know, what those co-pays look like, what deductible and co-insurance applies to what services. The next slide is very similar in look and format, but this shows only our silver plans. These are the plans that have cost share reductions associated with them. That's that additional layer of savings. We'll talk a little bit more about this in a few slides, but the cost share reductions are the additional layer of savings that are available to those folks between 100 and 250% of the federal poverty income guidelines. Again, this is in network. And it's important to remember too that silver plans, these silver plans that are on exchange, these are on exchange plans in order to get the advanced premium tax credit and the APT, or the cost share reductions. This too is on our website. So we've started to allude to some of these terms before, but let's just go over what some of these things mean. So what you need to know, premiums are based, these are the monthly payments that you make to your health insurer. These are based on age. So unfortunately, every year as we all get older, our premiums will go up. And they're based on tobacco use, whether you've used tobacco products in the last 6 months, and geography, so your zip code. As we know, rural expensive because there's less competition. So depending on your zip code, that may raise or lower your premium payment. The Advanced Premium Tax Credit, or APTC, is for folks that are between 100 and 400% of the federal poverty income guidelines. And those guidelines are shown below. It's based on percentage and household size. So if your family income does not meet the guidelines on the grid below, you are eligible to purchase off-exchange health insurance plans. If your family income guidelines fall within the chart, you are likely eligible for advanced premium tax credits, and that's, again, helping you pay your monthly premium. Additionally, I mentioned there's another layer of savings, and those are cost share reductions. And this is the price that you pay out of pocket. It would be reduced if your family income is between 100 and 250% of federal poverty income guidelines. So how you would read this chart is you define your family size, your household size, and then you would determine what your income looks like. And if it is, as I said, under 250% of the federal poverty guidelines, you might be eligible for CSRs. And if it's 400% or less, you might be eligible for advanced premium tax credits. So for out-of-pocket costs, just quickly to review some definitions, the deductible is a specified amount of money that you must pay before the insurance company will pay your claim. Out-of-pocket maximum was one of the provisions of the Affordable Care Act, and that's the most a member will pay in any plan year for covered services. So once you've met your out-of-pocket maximum, let's say it's $10,000 in September, then all covered services will be $0 cost to you. Again, covered services is key there. The copayment is the dollar amount that's made by you, in addition to that made by your insurer. Coinsurance often trips folks up. This is expressed as a percentage, and it's the share of the payment made by the member once the deductible has been met. And the insurer also covers part of that coinsurance. So if you have a 20% coinsurance, for example, once your deductible has been met, following services, you would pay 20% of the cost, the insurer would pay 80% of the cost, up until you've met your out-of-pocket maximum. Formulary is just a fancy term for the list of medicines that are covered and how they are covered under your plan. The formulary can be found on our website. It's a very long document, but we do encourage you to check it often for medicines that you take to see what tier they fall in and whether they are covered. And network is very important as well. This is the providers or healthcare facilities that are part of a health plan's network of providers, so those that we've negotiated a discount with. As I mentioned, Community Health Options, their broad network includes every hospital in Maine, many in New Hampshire, and several in eastern Massachusetts. On the right-hand side of this slide, you will see just a quick snapshot of our quick links section of our website, and that's right on our homepage, healthoptions.org. The compare and quote plans is towards the top, and that's where you would start, as we've mentioned, to be able to see what your plan options are and cost estimates are for 2018. And as I mentioned, the formulary is an important document to reference, and that is at the bottom of quick links, and that's going to be your list of covered medicines and how they are covered. So this next slide shows a grid that we designed how to compare your coverage options. We do have this also available on our website, so feel free to go to our website and print this out. If this were an in-person roundtable session, we would hand these out. This is just a worksheet that we, as I said, came up with. We found it useful to sort of look at, different plan options and write them down, and this would give you a sense of perhaps something that could work for you. So where do you start on this? Well, the first thing to do is to, we tried to list some commonly used services and to potentially come up with an estimate of how many times you think you might use or which ones you might use for 2018. So you can do that by looking back at your 2017 explanation of benefits, or you can just try to estimate what you think you may utilize for 2018. I often joke in these member roundtable sessions that I have young children, so I have no idea how many times I'll visit the emergency room, but I might be able to get a sense of, what tier 3 medications that my family and I might be using, or if I expect to use, outpatient therapy physical therapy, occupational therapy, that kind of thing. So your first step would be to get an estimate of about what you think you may use for 2018 based on these commonly used common services. And then across the top on the right-hand side, you would come up with some potential plans that might fit you. So if you're interested in maybe an HMO plan and 2 PPO plans, you can use the plan grid that we showed you, the eye test previously, and it'll show you it'll show you the deductible versus co-insurance, whether certain things will hit those out-of-pocket costs. It'll show you your co-payments if that's relevant, so it'll show you what your PCP specialty office visit might be. And then you can get a sense of whether, once you start to fill this grid in, if you so choose, it'll give you a sense of what your tolerance level is. So if you're, more interested in paying a higher premium but lower out-of-pocket costs, or vice versa, you'd like to keep your out-of-pocket costs lower, and so you're more comfortable with paying a higher premium each month. Beth just reminded me that you can also use this. You can also do this on our compare and quote tool on our website. You can compare up to 4 plans. I did this the other day. It's a very useful tool. That compare and quote plans button that we talked about. You can list up to 4 plans too. So that's kind of a nice online way to be able to visualize across plans. As I said, this document is available on our website, so please feel free to go to that and print it out if you find it useful. We'll talk a little bit more about some of the in-person assistance that's available to you, but we know this is complicated. So if you get stuck even when you're trying to compare your coverage options on something like this spreadsheet or this grid, please remember that in-person assistance is available with assisters and navigators in your community. So this is just a tool, and we do encourage you to connect with the in-person assistance, and we'll show you how to do that at the end. So on healthcare.gov's website, there is a button, and the website is right there, localhealth.healthcare.gov. This you could choose, you could select to find those in-person assisters, the navigators and the assisters within your community. We do encourage you, if you are interested in seeing an in-person assister, to get some boots on the ground help, to visit this website and then contact for your assister for an appointment sooner rather than later. Because open enrollment has been truncated this year and it's 6 weeks shorter than it has been in previous years, their appointments are filling up fast. So if you are interested in getting some in-person help, we recommend that you do that sooner than later. It might be hard to get an appointment on December 14th, for example, the day before open enrollment ends. I've talked about this quite a bit, but on our website, healthoptions.org, you can get a quote, you can review plans, and some of the coverage details also. The website here is listed as healthoptions.org, but as I said, you can either select the compare quote plans right from the quick links, or you can go through this longer link, but it's right on our website under quick links. And as I also mentioned, our formulary link is also right under quick links. This is an important document that you should reference if you are taking medications, so you'll see how they're covered. You'll also notice on the formulary page that there is a link for the 2017 formulary and the 2018 formulary, and so that will change for next year. So if you're looking for information for next year, be sure to select the 2018 link. Finally, it's also important to, and we remember orientation sessions, it's important to check the formulary frequently. They do change, and medications come on and off the formulary, so we recommend checking that formulary as often as you can, at least monthly, to make sure that the medication that you take hasn't changed categorization by tier or whether it's covered or not. So we mentioned some of the cost savings opportunities that are available to you as a member, and we just wanted to highlight what some of those are. We are, as we said, a member-directed nonprofit health plan, so we're really committed to bringing you innovative programs. I mentioned in the beginning, we have a very robust care management program. Our chronic illness support program, we've talked a little bit about. We cover behavioral health and substance misuse disorders in parity with medical services. So, for example, the first 3 behavioral health visits in any plan year are covered at a $0 out of pocket cost, because we strongly believe in access to behavioral health and substance misuse services. That's for 10 of 14 plans, 10 out of our 14 plans. And we've also launched a new partnership with RX Savings Solutions. This is a free tool available to our members that offers price transparency on certain prescription medications. This is something that you can be notified by text message or by email if a potential savings has shown up for a medication that you're prescribed or that you're taking. And you can enroll in RX Savings Solutions directly on our website, and you would go through your member portal in order to do that. That is a free service that's available to our members, and we do encourage you to enroll in RX Savings Solutions whether or not you think you're getting the best price on your medications, because you may find a cheaper alternative elsewhere. I mentioned our care management program. We're very proud of the team of nurses and licensed social workers and dietitians that work with us. And so these folks can help with transitions of care, with complex medical issues, and outreach to our members that are living with certain conditions, chronic conditions. So our care management program is also free of charge to our members. In order to connect with our care managers, all you would need to do is contact our member services folks, and they can connect you directly to our care management program. The toll-free number for member services is 855-624-6463. Again, that's 855-624-6463, and that number is also on our website. So feel free to visit that if you didn't catch it. So at this point, we can turn over to the chat to see if any questions have come up, and we can hopefully do our best to answer them.
And at this point, I don't see any questions coming through the group chat function. If anybody has, thank you, someone just wrote thank you, but not a question. So if anybody has any questions they'd like us to address, in addition to all the great information that Lee has shared with you, I would just add one thing. Lee emphasized that the assisters will be very busy with the abbreviated open enrollment period. So I would encourage people, as Lee said, to be in touch with them sooner rather than later. Be in touch with us at Member Services if you have questions sooner rather than later. But also if you're someone who's independently going to healthcare.gov to update your information or to make selections and enrollment decisions, please do that earlier as well. Healthcare.gov, this website will be tremendously busy right before that December 15th deadline. So anything that you can do to avoid being on that website those last couple of days might be advantageous to you.
That's a great point. Thank you, Beth.
And I don't see any other questions. We'll give it another minute and see if anybody has anything else that comes up to them. We do, as Lee mentioned, have a lot of information on the website and information about RX Savings Solutions. We encourage you to go to healthoptions.org and look and really see on your individual place what information is available to you and what resources are there, and a number of them that Lee has referred to during the course of this webinar, but also other things that may be of interest to you and your family around enrollment, around health insurance, but also around healthcare and some other interesting topics that are related.
The recording of today's webinar will also be posted to our website. So if you would like to to review what we've gone over. That will be posted probably by tomorrow or let's see, Friday at the latest. I expect that to be up. The slides for this webinar are already posted, so if you can't wait and you really want to see the slides, please go to our website under healthoptions.org under Individuals and Families, and it would be posted under Resources for Individuals. So if you missed anything or you'd like to listen again, please do check our website soon. Well, thank you for joining. We don't see any questions coming in. We appreciate the time that you took to spend some time and learn more about your plan options for next year. Again, please do remember that open enrollment ends on December 15th, and we appreciate the time that you took to spend an hour with us today. Thank you.